Try-in is the process of placing a trial denture in the patient's mouth for evaluation. It is also referred to as trial placement.
The armamentarium used for trying in is the molding wax, the cheek retractor, fixon, mirror, articulating paper, glass plate, straight hand piece, and the sandpaper.
Mandibular trial denture. The mandibular denture is first evaluated individually for the following, that is the peripheral extension, stability, tongue space, height of the occlusal plane. First, the lower denture has to be placed into the patient's mouth. Then the labial and the buccal borders are evaluated by moving the cheeks and lips inwards and downwards for the chewing movements. Then the lingual extension can be evaluated by protruding the tongue to moisten the lips. Then the posterior extension is evaluated by checking the extension on the retromolar pad region. Stability can be checked by applying pressure on one side of arch on premolar and molar region. If there is rise, it indicates instability. Here pressure is applied on one side of the arch. There is no rise on the other side, which indicates stability. Tongue space. The lower posterior teeth should be placed in the neutral zone between the cheeks and the tongue. Immediate movement of denture indicates lack of tongue space. So it is differentiated from lingual overextension where the movement occurs. So it can be evaluated by asking the patient to raise the tongue.
Evaluation of maxillary trial denture. The maxillary denture is evaluated individually for the following: peripheral outline including posterior palatal seal, stability and retention. Peripheral outline including posterior palatal seal, buccal and labial borders are checked by moving cheek downward and inward stimulating chewing movements. Overextension is distobuccal flange area is evaluated by asking the patient to open mouth wide. Underextension is evaluated similar to the lower denture. Retention. Retention is evaluated as follows. Trying to pull down the denture vertically by holding the denture in the incisor region using thumb and forefinger. To check retention in posterior seal area, forefinger is placed on the palatal surface of the upper anterior teeth and an outward force is applied. Applying upward and outward force on canine region to check retentiveness of denture in the maxillary tuberosity and pterygomaxillary notch region of the opposite side.
Evaluating both dentures together. Occlusion and jaw relation. Horizontal relation. Patient is guided into centric relation using any method to retrude the mandible. Errors in centric relation. Observed if space exists between upper and lower posterior teeth at first contact. Lower teeth slide over upper teeth on first contact. Vertical relation. Vertical dimension is evaluated using the method. Teeth are removed, replaced by wax occlusal rim, and a new record is made. Evenness of the occlusal contact. Contact of the teeth with equal pressure on the either side of the arch is essential for harmonious occlusion. Causes of uneven contact is resistant material used to record centric relation. Balanced occlusion causes are inaccurate facebow transfer, incorrect condylar path registration. Aesthetic, we see midline, anterior plane, shape, size and shade of the teeth, lip form in profile, and patient will be telling now phonetics.
What is the row? 66. Saraswati, Saraswati, what is the row?
P P
P,
B
B,
S
yes, P, F.
Approval of appearance by the patient. It is mandatory for the dentist to obtain patient approval or consent for the appearance of the trial denture. It may be advisable to ask the patient to bring a close relative or a friend during try-in, and the approval and suggestion of this person can also be considered if realistic and reasonable.